Hello, everybody. Welcome to the Lunch and Learn with Devoted. We'll give it just a couple more minutes here as all the participants fill in, and we'll get started. Just hang tight for a couple more seconds. All right, it's 12:01. I think we can go ahead and get started. It looks like the participants coming into the meetings kind of slowed down a little bit. So as people come in, they'll be ready to go. So I am Lisa Morey, the Senior Manager of Provider Network Services at Equality Health. Please let me thank you guys for spending your lunchtime with Equality Health and Devoted. As you are aware, Devoted is one of our payer partners, and together we are offering this training so that we can all learn a little bit more about Devoted Health Plan. I'll now turn it over to Keith Dines with Devoted.
Thank you very much, Lisa. Absolute pleasure. Good afternoon, everyone. As Lisa said, thank you very, very much for spending your lunch hour with us. My name is Keith Dines. I'm the Arizona Market President for Devoted Health, Devoted Health Plans of Arizona. So first, a few housekeeping items and some logistics. So our presentation today is scheduled to take about 30 minutes or so, and then we're going to leave 10, 15, 20 minutes for questions, if there are any questions at all. All the participants will actually be muted throughout the presentation. We welcome any questions and comments in free flow text throughout the presentation. And if you have any specific questions, utilize the chat function and type them out, and we will actually try and respond to a number of those questions throughout the presentation. And then for those that require a longer answer, we'll actually review those at the end of the presentation. You can also use the Q&A function as well. We'll be monitoring both of those channels. Once we are done with the presentation, all the participants will receive a follow-up email, and then we'll also include a link to a recording of today's Lunch and Learn. So if you have members of your team that were unable to participate, they can actually be shared the information through that link. So next slide, if you would, please. Sorry, next one, there we go. So this is going to be our agenda over the next 30 minutes or so. We'd like to take this opportunity to share with you a little bit of the story and backstory of who Devoted Health is, a little bit about why we are different as a Medicare Advantage plan, talk about our service area and coverage area within Arizona, introduce you to our team, and then we'll actually go over a little bit of our plan benefits, more from a 30,000-foot level, but kind of share with you some of the unique features of our plan offerings. And then our network team will share with you the must-known facts as it relates to the tools and resources available to you as our provider partners to make the experience with our members efficient for both them and for yourself. And finally, share with you some marketing tools and support services that we have available for you. Just real briefly, we are a new Medicare Advantage plan that will be entering the Arizona market in Maricopa County in 2021. We are a plan similar to United's AARP Medicare plan, Humana, Cigna, Blue Cross Blue Shield Advantage. Those would be our major peers and competitors in the space. We are a fairly new company nationally. We actually went live in 2019 in Florida, and then we launched in 2020 in Texas, and then in 2021 we'll be entering Arizona and Ohio, as well as expanding in several other counties within our existing states of Texas and Florida. As a new company, we were founded on a a foundational mission. And if you can go to the next slide, please. So our mission is pretty simple, and it's more than just words on a PowerPoint slide. It is truly how we have built and run the organization. And we're driven by a single, firmly held belief that as an organization, we will treat every member like their family, with loving care and a profound commitment to their health and well-being. And it's really around the caring for a member in a differentiated manner. And all plans can offer benefits. And so Devoted is not about benefits, although we offer and will offer competitive benefits, but it's more about providing a differentiated experience. And that differentiated experience is what drives our entire organization. So next slide. So we have three primary pillars as an organization. And this is what, as an organization, we stay laser focused on. And it is around earning and maintaining a level of trust with our providers and with our members. And that trust is earned every single day in the way that we interact with our members and with our providers. And our entire organization's technology infrastructure was built around that. Devoted is the only Medicare Advantage plan that was actually built from the ground up. So we have a technology platform that was not built off of the 1970s platform and then made to work for Medicare Advantage. It was actually built in order to make sure that the information was available at the right place at the right time in an efficient and effective manner, so that the providers, our member service guides, our clinical guides, all have access to the clinical information on a longitudinal basis, as real time as it possibly is available. Everything is in a single system and a single platform. Our organization was built on that technology platform by engineers, and that we recruited from Amazon, Microsoft, Facebook, and others that are, including Google, that so the technology is on modern technology. We update our system anywhere from 30 to 40 times a day. That's to make sure that what needs to happen happens timely and on a proactive manner. Most of our competitors will update their system every 6 months, and when they do that, something breaks. So the other benefit of the new technology platform is that it's more of an open architecture approach, so that we can readily share information with our data partners, including all of our physician partners as well. So secondly, we care for members as we would our own family. And that's a cultural foundation. It's also what our founders have defined as the organization's prime directive. And that is, and they encourage our providers, we encourage our staff, our team, before embarking on any action, we're told to close our eyes and envision your mom, your dad, your grandma, your grandpa, and ask yourself, what would I do for them? And then as long as it's compliant with Medicare and with CMS, that's what we encourage you to do. Our belief is that we all want to do the right thing. So if we want to do the right thing for mom and dad, that's what we encourage. And we have built our systems to encourage that and to actually facilitate that decision-making process. Bottom line is, we want to treat every member of Devoted, again, as a member of our own family. And then finally, our focus is on long-term relationships and not short-term, quarter-by-quarter results. It's about making sure that as an organization, we're making decisions that impact you, impact your physicians, and impact the members over the long term. So next slide, please. So proof is always in the pudding. And within our current 2 states that we're operating, it's focused on results. And currently, we credential physician partners within less than 20 days on average. And most of our competitors will take 3 to 6 months. So if you have a new provider join your practice, it should take less than 3 weeks from point of initial application to full credentialing. Next is we process, authorizations, standard authorizations in less than 3 days, and expedited in less than 1 day. And then what's important to each and every one of you, I am sure, and that is how do we pay claims? And we currently adjudicate more than 95% of our claims within less than 3 days. And that's not a typo. It's not 30 days. It's not 300 days. It's within 3 days. And that's because we have built the technology based on current technology to auto adjudicate as many claims as possible. And then it's about service to our providers and to our members. So if we're going to treat everybody like mom, we want to be able to have mom talk to an individual, a real live human being. So we actually answer more than 80% of our member service calls in less than 30 seconds. And we resolve more than 80% of those calls on the same day. And that's because we have the technology platform in place in order to make sure all the relevant information is in one place. We actually have, I think I mentioned earlier, that some of the engineers we hired were actually from Facebook, and in some of the technology, we actually have our own timeline for every single member that has all the information from date of initial contact with that prospective member all the way through current date of service. It's in one place. So it's having that information available and having our member service guides empowered to solve problems has actually made a significant difference in our members' experience and your experience. Our medical directors are readily available directly one-to-one with your providers, available by phone or by Zoom or Google Meets or others. And then our commitment is that we want our members to be able to speak to a real person every time they call. Next slide, please. So coverage area, next slide. Pretty simple. It's where all of you are. So within Arizona, our current service area is Maricopa County only. So we're not in Pima or Pinal, just Maricopa. And we cover the entire 9,000 square miles in partnership with Equality Health and others. And we're actually very proud to be a part of Equality Health as we enter into the Phoenix market. Next slide. Our team, okay. There we go. So our founders are Ed and Todd Park. Many of you may be familiar with, if not them, then what they effectively implemented and created themselves, along with a technology team of creating actually the world's largest in-place electronic medical record system, which is Athena. So they were the founders of Athena. And Todd Park was the Chief Technology Officer for the United States of America and actually oversaw many of the initiatives from a health technology perspective during the Obama administration. They are very, very committed. They remain and maintain founders control as an organization, and they're committed to the long-term solutioning of improving healthcare for America's seniors. Next slide. Locally, we have a team that is long established here in the Arizona marketplace. So myself as the market president, I've been here for 35 years in different levels of executive leadership with the Sun Health system, as well as along with Rick Rock, I started Sun Health Medicine, which is now Blue Cross Blue Shield Advantage, as well as ran Arizona Integrated Physicians and Arizona Primary Care. So a lot of experience in the Arizona market. Rick has been part of the Arizona leadership team for the last 25 years as well. And Dr. Brian Rivlin has also been in the market for more than 30 years as a practicing physician and leader of one of Arizona's largest primary care groups. So you have an established, experienced local leadership team that has walked in many of your shoes. Next slide. We also have Tiffany Turner, who will work with a lot of your offices on network performance. Tina Fitzloff oversees our networks, and then Nicole Blue is our Director of Sales. Nicole was previously with Cigna HealthSpring. Okay, next slide, please. And then to round off the leadership team, we have Nancy Go, who is our Chief Marketing Officer from a national devoted perspective. Nancy was the Chief Marketing Officer with a small company you may have heard of called Wayfair. And Sherry Witherspoon oversees all of our provider marketing initiatives, and Lene Connolly is our Provider Awareness Director. Next slide. So I'd like to turn it over to Dr. Brian Rivlin, who is Arizona's Chief Medical Officer and Medical Director, who will walk you through our clinical experts and clinical guides. Brian?
Thank you, Keith. And I also thank the audience for being with us. It's a pleasure to spend a few moments with you and share the devoted story. And I really want to re-emphasize what Keith had said previously, in that the culture of this organization throughout the organization is that of taking care of the members, your patients, just as if they were family members. And as a part of that, we have developed several teams that are here to assist our providers as well as our patients in regards to any of the issues that come up naturally with not only their medical issues, but having to deal with a healthcare system that can be very complex and overwhelming for anybody that tries to use it. One of the key groups that have been put together is our clinical guide team. So our clinical guide team is made up of licensed RNs that have a variety of backgrounds in clinical and business in their ability to help patients navigate through the very complex system we have. They are there in order to eliminate any hassles for our members that they may be having as it relates to trying to get to the right care at the right time, with getting to our vendors that are assisting with the care of our patients, and to help coordinate the care with our PCPs and specialists in the network. They play a very critical role, and oftentimes put that extra effort in and really put the energy into communicating well with our patients. They are also involved in reviewing our prior authorizations alongside our medical directors. And so our entire clinical team is working together hand in hand to provide the best care. If we can go to the next slide, please. So in addition to the clinical guides, we have a variety of teams within the organization to, again, assist with the members navigating through the healthcare system. So we have what are called member service guides, and member service guides actually take that extra time with our members that help them understand what their benefits are, to be able to be a resource when needed for coordinating, getting to other team members, as well as anything that if they might have an issue with a payment issue, with a claim issue, with a pharmacy issue, they help connect the patients with all the rest of our teams. In addition, we have our provider guides and network team that works very, very closely with our providers to make sure that we are communicating well as an organization with our providers. We actually, the term that's coined by our founders is we really want to be a payvider. We want to work hand in hand with our providers and make sure we're there to assist the care that you are providing to the patients. We have a fantastic pharmacy team that is expanding rapidly. These are clinical pharmacists as well as support members, and they help members with trying to, if they're having issues with their medication, filling their medications, if they're having problems getting their medications. If we have, they're integral in the part of medication reconciliation as well as medication adherence, and they help people with finding alternatives if they have issues with any of their prescriptions. This team is very, very actively engaged with our patients and helping coordinate with the primary care providers. We, of course, have a very important team that we wouldn't be here without, and that is sales and marketing team. And you'll get to hear a bit more about that coming up. We have our provider performance team, which of course locally is led by Tiffany Turner here, and we're really here to be that help and assist with achieving the metrics that we know that you want to achieve as a primary care and specialist, but also that help us achieve our STARS and HEDIS measures that really shows the great work that you are doing for caring for our patients. In addition, we have devoted medical group that it is providing medical services to in-home, and it is meant to be an adjunct to any care that is being provided elsewhere. These are targeted to members that might have troubles with transportation, that might have issues in connecting with their providers, have issues associated with transitions of care out of the hospital. And really the group is there to be another hand for our partnered providers, not in any way to get in the way of the care that is being delivered, but really to help augment that care. And so with that, I'm going to turn it back to Keith.
Great. Thank you, Dr. Evelyn. Appreciate that very much. It reminds me of comments that have been shared by our founders, again, Ed and Todd Park, regarding the development of all these support services that are then, the way they have likened it is that our clinical and member service guides are professional daughter and son teams powered by care and technology. Right? So if we're going to care for mom and dad, we need to make sure that we have access to the right information at the right time and actually be caring the way we deliver it. And next slide, if you would please. Right, so as we enter into our launch, which is you'll see us starting to position some brand marketing now. You'll see the devoted logos on some billboards around town. We'll start doing some print media, and then October 1st, a very aggressive sales and marketing and branding strategy. And that ultimately initiates the AEP open enrollment period for 2021, which starts on October 15, where we can begin to sell the actual products. And we spent a tremendous amount of time before we developed our products in meeting with providers here in Arizona in the Phoenix market and with brokers and determining what is missing from a plan benefit design that will help enhance the member's experience and ensure that we're providing the right service at the right time. And that actually was the driver of our 2021 benefits. So with that, I'd like to turn this over to Nicole Blue, our Director of Sales. She's going to share with you a few highlights of the plan offerings that we have built that I think you'll quickly see are materially differentiated from our competitors in the market. So with that, Nicole.
Thanks, Keith. We can go to the next slide. Hello, everyone. I'm Nicole Blue. I'm the Sales Director, and it's my pleasure to be here today. I just want to take a few minutes to do a high-level overview of 3 very unique plans that we are bringing to the market. We're about a week and a half away from being able to roll these out to Medicare beneficiaries. So we are very excited for that opportunity to come. So I want to just actually start by saying and reiterating that these benefits are a direct result of discussions that were had with broker partners and providers that were involved in a roundtable earlier this year with our executive team. So very excited that we have some unique opportunities in this market to really make an impact on Medicare beneficiaries. So I'm going to actually go plan by plan here. So I want to start with our Flex plan. This is a plan that is unlike any plan that we have seen in this market or nationwide for that matter. All 3 of our plans are HMO structured and do have a network of physicians, including Equality itself. But with our Flex plan, we created an opportunity for individuals to really have a plan that they can use for their own Medicare needs. So what that means is this plan, when we say flex, means it's flexible. This plan does not require referrals, but they are still required to use in-network physicians. And we are going to give the beneficiary a quarterly allowance of $750 that they can use as they see fit for their own healthcare journey. that $750 does roll over quarter to quarter throughout the year. Keep in mind, it does not roll over year to year. So they do need to use those dollars by the end of the year. But those monies can be used for things such as fitness classes. If they want to buy a personal fitness equipment for their home, they can use that. Acupuncture, massage therapy, gym memberships, weight loss management, things like that. We really are gearing this plan to be for those individuals who are low utilizers of healthcare. Think about the individual who's aging into Medicare, or that healthy individual that's on a supplemental plan that wants the freedom to go where they want. They don't really want a ton of restrictions. That's who this plan is for. So our Flex plan will have a premium of $39 a month. And it does require them to use those in-network doctors, but they can see any primary care physician at no cost. And if they are given a referral or need to see a specialist, that's $35. There's no cost for labs, and they have low out-of-pocket expenses for their RX copays. So $0 for tier 1 generics, $5 for tier 2 generics, $45 for preferred brand name medications, and $95 for non-preferred. And then 33% coinsurance for specialty medications. All three of our plans have a $0 deductible for medical and prescription. I also want to highlight that all three of our plans offer insulin at $35 capped. That does include in the coverage gap as well. Now on this Flex plan, we do provide hearing aid coverage, $599 for advanced hearing aids, and then premium are $899. I'm going to go through the two lines at the bottom here in just a few minutes for all three plans. But again, that Flex plan, $39 a month, they get a quarterly allowance that they can use towards their health care as they see fit for them. I want to go over our core plan. Our core plan really is our standard $0 HMO plan that we're telling our brokers, you need to roll this out, have this in your front pocket for any member that's looking for a $0 premium option. This one does have no monthly premium, but members still have to pay their Part B to Medicare. The maximum out of pocket on this, very low at $3,200. No cost to see primary care, and only a $20 specialist copay. Again, lab copay is low, and then the same RX copays as our Flex plan. Now the hearing aid benefit, a little bit lower, $399 for advanced hearing aids, $699 for advanced hearing aids. I also want to highlight one thing with our hearing aid coverage. They're getting so much more than just the actual hearing aid themselves. We're supporting those hearing aids and that customer in the background. So in addition to the actual device, they are getting 48 batteries for those that require batteries. They get a 3-year warranty. They get 3 visits with the physician or the audiologist for fittings and readjustments if necessary. We also allow them to have a 45-day trial period. I recently just helped my mom buy her hearing aids, and she paid almost $3,000 for one, and then she stopped wearing them about a month into it. So how nice is that they can actually try them out, and if they decide it's not the right hearing aid for me or whatever reason, they can actually get a refund on those. So I get excited about that because it's so much more than just an actual device. And then I want to talk about our Select plan. So our Select plan is what we're considering our low income subsidy or LIS plan. It's really meant for those individuals who have the LIS program. If they have the full subsidy, they actually get their premium paid for. So you'll see on here, there is a premium of $36.10. Now, anybody can join this plan. You don't have to have the low income subsidy program. So even if you don't have it, there is a benefit to paying that $36 a month premium. You're going to get much lower out-of-pocket expenses at the time of service. So let's look at this plan. No primary care doctor copays. Again, I think you're seeing a trend here. We don't charge for PCP, but really low specialist copay of $5. I mean, think about that. Think of your patients that currently are struggling between going to see their cardiologist and maybe, putting food on the table. This is going to be a big help for those individuals who have low income. No lab copay, of course, and then we're actually reducing the coverage on our RX. So all their generics, tier 1 and tier 2, $0. $45 for the brand name, $95 for the non-preferred brand name. I want to stress, Insulin is capped at $35, and that includes in the coverage gap. So this is big for those diabetics that typically see themselves falling into the donut hole around April, May timeframe. They're not going to have to pay 25% of that insulin when they hit the donut hole. It's capped at $35. And then hearing aid benefit. This is huge. They can get that premium hearing aid at $199, or advanced hearing aid at $199, or premium at $499. And again, they get all that service behind it: the extended warranties, the batteries, the visits, and whatnot. So there's so much more I could go over with you, but I only had one slide that I could present because of time. So I do want to highlight two things that I think really make Devoted stand out. Not only do we have these great benefits, but we really are working to make sure that our members are getting preventive care, and we want to reward them for that. So we do have what we call Devoted dollars. So when our members go to the PCP for things such as preventative screening, cancer screenings, mammograms, colorectal cancer screenings, and their flu shots, we're going to incentivize them. We're going to reward them. So every member who gets these services will receive a gift card in the mail. The denomination is between $10 and $25, depending on the service. And it's a Visa gift card between $10 and $25. And that's just a way of us saying, thank you for putting your health and making it a priority to you. There's nothing you as the providers have to do. There's nothing the member has to do. Those are going to be mailed based off of claims data. And then lastly, we're giving all of our members the option to have a PERS device. If you're not familiar with this, it's a personal emergency response device that they can wear around their neck or keep close to them. And if they fall or have a medical emergency, they can press a button to be connected to someone who can get help for them. This is something we include at no cost for the member. They just need to call our guide team to ask for it. We cover the monthly fees, and that includes fall detection. So that's about a $45 a month benefit for them that we're giving them just for being a member of Devoted. And it relates all back to what Keith was saying. We want to make decisions. We want to make plans that we would want for our own parents. So I think this is a perfect example of us doing the right thing for our members. So with that said, if there's any need or any questions or anything else I can do for you guys, my information should have been in the invite, I believe, but we're also available to come out and educate your offices more, whether that be virtually or in person, if you want to dive deeper into these. So thank you for your time, and I'll hand it back over to Keith.
Thank you very much, Nicole. As you can tell, Nicole's not excited at all about this benefit offering. Actually, we're all excited. The brokers are excited, and everybody we've talked to that have actually previewed what we're offering are very excited about what's coming up. And it's not just about the benefits, as I mentioned earlier, it's really about the experience. I want to remind everyone, if you have any questions or comments, please go ahead and utilize the chat function, and we'll make sure that we get those addressed for you. At this point, I'd like to turn it over to Tina Fitzloff, and Tina is going to share with you the must-known facts about how do you link with Devoted from a provider office perspective. Tina?
Thank you, Keith. If we could advance a slide, please. So my name is Tina Fitzloff. I'm Director of Network Operations for the Arizona market. And in these next few slides, I'll provide you with a brief overview of all of the provider resources and tools that we have available for you. Next slide. And the next one. Thank you. Devoted uses Availity for its provider portal. So by logging on to Availity, you'll be able to check member eligibility, submit referrals and prior authorizations, and complete electronic claim submission, ERA, and remittance review. There'll be a section in Availity called Payer Spaces, in which you'll be able to see news, resources, and announcements from Devoted Health. Next slide. Our reference tools. The Devoted website is packed with resources to help you find answers on how our plan will work. Today, you can go online and browse through our provider manual or take a quick look at our quick reference guide. Very soon, you'll be able to search our provider directory and formulary, review our auth and referral submission guide, or check out our HEDIS tip sheet. Next slide. At Devoted, we have an exhaustive list of additional services that PCPs can perform and get reimbursed for. Please check the payment exhibit of your agreement for a list of these services. And if there's something that you would like to see added to the list, just let us know. Next slide. Provider information. We ask that you provide us with an email address to ensure that you receive all pertinent communication from Devoted. Any provider changes, adds, or terms should be communicated to your network partner as soon as they occur. Next slide. This is the Devoted member ID card. This is another thing that shows off our difference. This card can easily be found in the member's wallet because it stands out due to the orange color. And it's this one card that's used for everything. To see your PCP and specialist, including dental, vision, and behavioral health providers. Next slide. Here at Devoted Health, we let you have the control. We have a provider catalog where you can order your own Devoted Health supplies online. You just follow the link, create your own account, and order your Devoted Health items. Shipping for your first order is on us, and due to COVID, shipping charges have been waived on future orders until further notice. I do want to let you know that our sales team will be stopping by your offices in October to deliver some of the Devoted brochure holders along with some brochures that you can share with your patients. And if you wouldn't mind clicking on the link to the catalog, thank you. But please feel free to browse the catalog for fun stuff like nail polish and hot sauce, or any of the essentials like face masks and hand sanitizer. Thank you. We'll go back and advance to the next slide. So here's what you can expect. Beginning in October, the Devoted sales team will be delivering the brochure holders and asking to meet with you for a benefit overview. October 15th begins our annual enrollment period for new members. And coming in November and December, the Arizona Network team will be scheduling provider in-service training to go in depth on all the tools and resources that are offered by Devoted. January 1st, 2021 is our go live date for new members and providers. Next slide. So this concludes our introduction to the Devoted Health Lunch and Learn presentation. Remember that almost anything you need to know about how to work with Devoted Health can be found on our website. But when you want that personal touch, please feel free to reach out to your local Arizona Network Operations team. Again, my name is Tina Fitzloff. I'm the Director of Network Operations. We also have Sheila Patel. She is a Arizona Network Manager, and she is actually going to be dedicated to serving the providers in the Equality Health Network. And then we also have Rebecca Joyce that will be available to help as needed. If you have any questions, you can always send us an email at the email address listed on this slide. And now I will turn it over to Keith for our wrap up and to go over questions.
Great. Thank you very much, Tina. Appreciate it. I'd like to just reiterate a few things that Tina was talking about, and that is, and it actually permeates the entire organization, and that is we want to be the plan that you enjoy working with, right? It may be going as far as saying you love to work with. The reality is that what we have built in the technology solutioning, the cultural approach, is we want to not be an obstacle like most plans are, but we want to be a facilitator to the access and availability of great care. And so if there are things that just aren't working, we're new in the market, so there will always be some bumps in the road. But if there are things that just aren't working, or ideas of how we can better improve our performance and our linkage, whether it's through technology, it is policies and procedures that we have in place, whatever it might be, we ask that you reach out to us. We will listen. And again, we've been in your shoes. And so what we want to do again is be a facilitator to access great care. So with that, I want to thank you for the time you spent with us today. We hope you got to enjoy some lunch during this time period. And we look forward to working with you as a partner through with Equality Health and with you as individual partners. I think what we'll do now is we'll actually go over some of the questions that we received through the chat function in the Q&A, and then we'll do a final wrap. So Nicole or Rick, are there any questions that have come up that we'd like to go ahead and address with the group?
So Keith, there was a question from Sarah in regards to some benefits. So Sarah, I'll go over that briefly here. So dental, preventive dental is included in both our core and our select plan. So that's preventive. So 2 cleanings a year, as well as the exam, and then x-rays. And then for our flex plan, they can use those flex dollars for any dental services. And they actually don't need to use a in-network dental provider for the flex plan. They can go to any dental office that they would like. The next question was around physical therapy. So let me just pull up my grid here, because sometimes I got to get refreshers myself. So physical therapy, give me just a moment here, is going to be on our, so there's different for each plan. So on our flex plan, physical therapy is going to be $40 in an outpatient hospital setting, or $30 at an office or rehabilitation facility. On the core plan, $20 outpatient hospital, or $10 for in-office or rehab facility. And then on the select plan, which is that what we're calling the LIS plan, $0 if it's in office or at a rehab facility, and only $10 if it's outpatient hospital. And then I'm going to go back to your other question here, I think was around eye coverage. So we actually have a great benefit for our eyewear, $0 for the routine eye exams. And then on our core plan and our select plan, we do provide up to $230 for eyewear. If the eyewear is at a VisionWorks, if it's at any other provider, then it's up to $180. And then on the flex plan for eyewear, they can use those flex dollars as well. And then the last question was on mental health services. So mental health services are going to be on the flex plan, a $35 copay for individual or group therapy. And then on the core, it's $10 if it's with a licensed social worker, or $10 if it is with group therapy visits. And then for individual, it's $20. So I know this might get a little confusing here. On our select plan, it's going to be $10 flat for group or individual. And then I just want to stress as well, if it is just a med adherence visit, it's going to be $10 flat on all 3 plans. And I think that covered those questions. There was also a question in the Q&A that Dr. Rivland said he would answer live. And I think that Keith, you might have touched on it, but I'll hand it over to Dr. Rivland to add any other talking points he would like to discuss.
Sure, and part of that was my ignorance with using the Q&A function. So I actually put it off until Keith got to that slide. Hopefully it answered the question about our founders, because obviously the entire culture of this organization comes from Todd and Ed Park, who really are the driving forces behind who we are, what we are, and all the excellent culture we have here. So,
thank Dr. Rivland. This is Rick Rock again. I'm over the network in the Arizona market. I'd like to just take it one step further. You know, as young, successful entrepreneurs, they really don't need to be doing anything, and they started helping their parents actually navigate the healthcare system as they retired and moved into Medicare Advantage, and they just said, we have to fix this. So it is truly a life mission, passion project for the founders. Keith, there was a question about LIS qualification and income level. So what percent, probably it's linked to a percentage of the federal poverty level, but at what percentage or what's the qualification that a member can receive the LIS subsidy?
So Rick, I can actually take that since I have those numbers up on my screen right now. So keep in mind, folks, this does change for next year. And as soon as those LAS levels are released, we'd be happy to distribute that as well during one of our visits or in another means. But currently, for the LAS levels, you need to make $19,140 per year or less if you live alone. And that's $25,860 if it's a couple to apply for or to be eligible for the LAS. I also want to stress too that there's other factors that are taken into consideration. So if you are currently supporting like a beneficiary supporting, let's say, a disabled child or something like that, they do take that into consideration. So please feel free to utilize your devoted community outreach specialists and sales agents as they are trained on the low income subsidy program and can assist any of your patients on applying for that. There's no pressure to even enroll in a devoted plan. That is something we can just assist with. Again, doing the right thing for our members.
That's great. Thank you, Nicole. Great information. Any other questions that came in or comments that we would like to share from a leadership team perspective? Hearing none, we would like to go ahead and be respectful of the time. We hope that you enjoyed your lunch, and again, we look forward to working with you with Equality Health as an organization with each and every one of you. We encourage, reach out to Tina's team if you have any particular issues. Obviously, you continue to work through your Equality Health network managers and performance managers, but we're also there to help support any needs that you might have that can improve the experience for our members. Also, feel free to reach out to Nicole Blue and her entire sales team. They're more than happy to share with you additional information. We have a lot of marketing collateral and tools and resources, including Medicare 101 information. We have, and maybe Nicole, you can briefly talk about the bags that we've made available as well. They have a lot of tools and resources within them.
Yes, so we will have what we're calling our senior appreciation bags. We're in the process of ordering those, and once they come in, we do have to combine them. So myself and Sherry will be working on that, but we would love to deliver those to your office that you can hand out to your seniors. Those bags will have, it'll be a devoted tote bag that will have PPE gear in it. So it will have hand sanitizer. I believe it'll have hand wipes as well as a devoted mask. And then in that, we will also put just information on Devoted Health's plans. It'll be a trifold brochure, similar to what you will see us dropping off for your for you to have either in your office or in the back office, whatever you prefer as a practice. So I will say that all of that is coming on pallets to my house probably in the next week or so. So be patient with us while we get those, but we're really excited to be able to provide those to you to give out to your member or to your patients.
So take advantage of the offer to get these senior appreciation bags and maybe give one to grandma and grandpa. So on behalf of Devoted Health, we sincerely appreciate your time.
I'm sorry, one last interruption. We just got a question in about receiving the slides. We will send out, again, a recording of this, which will include the slides. Tina, I'm not sure if we were going to send the slides themselves, but I'm sure we can do that also.
Yeah, I'm sure we can accommodate that.
Yep. Sorry, Keith.
Okay,
go ahead.
That's quite okay. So again, on behalf of the leadership team, again, we thank you so much. We look forward to working with you, and hopefully someday soon we'll be able to do this in person. So take care. Again, thank you very much.